Welcome back. We're here now with Kelly Miller, also from the Northern Illinois Hospice and Grief Center. Now we want to tackle some of the myths that we've all heard about hospice and really are not true, right? Because there are a lot of misperceptions out there.
Certainly.
So let's start with the first one. Hospice is for the elderly and those who have terminal cancer. I mean, I think that's what a lot of us thought.
Right. And it's really unfortunate that people do think that. Hospice is for anyone with a life-limiting illness. Actually, less than 50% of our patients have a diagnosis of cancer. Okay. We serve all terminal illnesses, be it kidney failure, pulmonary disease, chronic heart failure, AIDS, ALS. And in regards to the elderly, hospice is also for anyone that has a life-limiting illness. Unfortunately, we've served infants and people in their 20s and 40s, and currently we have a patient that just turned 100. So.
Wow, that's amazing. Yeah, because I mean, not to say that it's not for the elderly and not for those with cancer, but it extends so much beyond that.
That's right.
Yeah, I know my sister just had a baby last week, and I can't imagine trying to go through, our whole family is so excited about that. I can't imagine trying to go through the loss of a baby. How often do you have to deal with that?
Not very frequently, and that's a good thing. It's very difficult on our staff also. And not only are you, you're dealing with it being just difficult for the staff, but the family is having such a hard time. So it really requires a lot of additional support from our social workers, and we also provide grief support too.
Because with a baby, that's really unique, because Rebecca was mentioning before the break that the support is for the person diagnosed and also for the family. But in the case of a baby, the baby doesn't know what's going on, but it's really the family that's really going through a hard time. Definitely. So that's a good myth to know. So really, hospice is for anyone who feels like they need it can contact you, right? Right.
Anybody that has been given a diagnosis of 6 months or less, hospice can come in and provide then the medical, emotional, and spiritual support for the patient, and at the same time provide the education and support for the family.
And we've got the information we can go ahead and put up on your screen right now. The number again, 815-HOSPICE, or you can go to northernillinoishospice.org for more information. All right, let's talk about this second myth, and that is that hospice is just for the final days and hours.
That's a really sad misconception, because as Rebecca mentioned earlier, the sooner that a person is able to get into a hospice program, the more likely they are to realize the benefits of pain and symptom management. When a person has their pain under control and their symptoms are managed, they're able to do the things they love and spend more quality time with their loved ones and doing the things that they enjoy. Unfortunately, though, we see so many patients come into the program at such a late stage in the disease progression. And unfortunately, they don't fully get to realize those benefits. And there's a couple reasons for that. Number one, people don't want to give up. They want to keep going forward with looking for cures. And really, it's an individual decision to decide when the benefits are no longer as great as the burden of the treatments. And physicians, as wonderful as they are, and they are trained to cure us and to treat us, they often aren't willing to give up either, or to even suggest hospice, because in a way too, then there's nothing left they can do. So really, hospice is a redirection of the focus, and if people can just remember that that is what it is, redirecting the focus towards comfort care, and getting into it earlier to realize those benefits is so important.
Do you think there needs to be a shift in how people think of hospice? Maybe that it's not giving up, but it's letting go?
Certainly,
you know
certainly. Exactly. One of our medical directors and a doctor that serves on our board currently is very adamant about that when he talks to patients, that it is just a redirection of focus, and we are going to now focus on keeping you comfortable and enjoying that quality, not necessarily the quantity, but the quality of time that you have.
Which is so important.
Right.
Myth number 3, hospice is expensive.
This is also a very sad misconception, and especially in the economic times that we are having, there's so many people that are putting off seeing the doctor, not having the treatments that they might need. not getting the medications they need because of the cost and the lack of insurance. So I think hospice is just kind of lumped into that, and it's not true at all. Hospice is covered by Medicare and Medicaid, and most all private pay insurances have a hospice benefit. One of the wonderful things about Northern Illinois Hospice and Grief Center is that we never turn anybody away based on their inability to pay.
Okay.
We are a nonprofit hospice, and we were we're one of the oldest in the area, and we were started with the mission of serving everyone in the community that needs our services. And because we've been around for so many years, we have been able to gather such tremendous community support. We have wonderful donors. We have fundraising events that are well supported, and that allows us to be able to provide that service to anyone.
Do you find that people, I mean, if you're already swamped with medical bills and you're already tight on money, I would imagine the first thought is like, well, emotional problems I can deal with on my own because that'll save the money. Do you find that people kind of do that?
Certainly, and that's another thing to mention with our grief center. We do have a grief center, and that is on a sliding scale also. So there is help available, and if anything, if hospice isn't right for the person at the time, or the grief services, we're there as a community resource too. We have a broad range of knowledge on staff that can really help direct people in getting the resources that they need at a really scary time.
So really, whether you can afford it or not, chances are there's a way to make hospice work out.
Exactly.
All right.
Exactly. And we'll never turn anybody away.
That's really, really good to know. And finally, the last myth, hospice speeds up the dying process. And I think a lot of people kind of come into it thinking, like you were talking earlier, thinking, well, this is the last thing. This is when you give up.
Right. And that's very unfortunate also. Actually, a Medicare survey that was done a few years back found that patients that were on a hospice program lived an average of 27 days longer than someone that did not have hospice care. And
so it really does help.
It can. Every person is individualized, but as Rebecca mentioned, when the pain and the symptoms are managed, people are so much more comfortable, and they're usually in their homes. They're surrounded by what they love. Their will to live is greater then, and so it is not. The hospice is not going to speed up death, and it's not going to prolong it. I want to make sure that I make that clear too. But we do see that it does certainly increase quality of life.
Quality for sure. Let's put the information up on your screen one more time about how you can get in touch. If you could go over this with us, because there's a couple different ways. You have a website and a phone number also.
Certainly. We can be reached at 815-HOSPICE, or our website is www.northernillinoishospice.org. And again, we are located at 4215 Newburgh Road in Rockford. And you're welcome to call us, like I mentioned earlier, just for questions. If you'd like to meet with us, meet with a nurse, social worker, a grief counselor, we're just a phone call away.
Great. All right, we'll have that information for you again right after the break. We'll be right back.